Hi, I'm Dr. Alexis Abramson. As a lifestyle gerontologist, I'm passionate about understanding the needs of the mature adult. I've joined forces with Hearing Life because they're a company committed to delivering unsurpassed hearing health care. And they're a company that continuously seeks to educate the mature adult through workshops, seminars, and videos. Dr. Carol Whitcomb Powell is with me today. She's a PhD audiologist with Hearing Associates, a Hearing Life company. Welcome, Dr. Powell.
Thank you very much.
So let's start with a basic question. How does someone know if they need to get their hearing checked?
Great question to start with. Hearing loss comes on gradually. If you have a sudden loss and you're deaf, you know it. But the symptoms of hearing loss are often progressive and slow. Your first symptoms are something perhaps like, the teenagers are talking too fast. I can't understand them. Or my wife's mumbling. I had a great young woman in our practice the other day who was furious at her church. She was convinced they weren't turning up the sound system so she could hear. And in fact, wasn't the sound system at church, but it was a gradual change in her hearing that she didn't expect.
Let's talk a little bit, Dr. Powell, about the technology. I know like back in the day, it used to be kind of big, clunky, beige hearing devices. And now it seems like they're almost invisible and very discreet. Tell me a little bit about the changes that have happened and what's happening in technology now.
With the advent of the digital age coming into hearing aids, we've had fabulous improvements in size and in how well they help you hear. Hearing aids can be virtually non-showing, with very, very tiny ones like the tip of my finger, if you have the correct ear size and the appropriate hearing loss. And very common hearing aid now that a lot of people are enjoying is a very thin wire with actually the receiver, the speaker in the ear canal, and the hearing aid sits behind. Again, cosmetically very pleasing. But for me as an audiologist, the improvements in technology and how well we can help someone hear is equally or more exciting. Hearing aids today can adjust loud sounds independently from conversational level sounds, individually from soft sounds. So perhaps your hearing loss may be such that you hear loud, great. If everybody was loud, you'd be great, but people aren't. You need just an amplification for soft sounds. Or maybe you'll say, I'm just struggling with conversation, and we can turn up conversation sounds.
I hear that you can, sync your hearing devices with a Bluetooth? So, in terms of, your cell phone. Tell me a little bit about that.
Bluetooth technology has lit up the hearing aid world. It's an extra set of accessories that help the hearing impaired have a better lifestyle, basically. And Bluetooth compatible hearing aids allow you to literally have your cell phone ring, perhaps it's over here, and you have a device that's like a small iPod around your neck. You press a button and the telephone goes through your hearing aid, so it uses the prescription of your hearing aids, and you're hearing with both ears on the phone and your hands free. Same thing for the television. It's fabulous. The signal from the television goes in through the hearing aids, so it uses the prescription of the hearing aids, and it sounds like the television's right here. And then your spouse, your loved one, can adjust the TV wherever they need it, and you've got the volume that you need.
Should I bring someone with me if I'm going to get my hearing checked?
We encourage that for everybody. When you're hearing impaired, it's hard to hear. And so we're giving lots of information during the exam and following the exam, our recommendations on your treatment. And often by having a companion there, you've got a second set of ears to help hear and understand what we're saying. And a lot of times the companion is who they live with. So it's the companion that gets to see the hearing loss from a whole other set of eyes also. So that gives us the information from the patient and how they view their hearing loss, along with the information from the caregiver and how they view the hearing loss.
I know, having been a primary caregiver, I kind of felt like when I was with my grandmother, She felt differently than I did. She was struggling from lack of hearing, and I was struggling because she couldn't hear me. Let's talk a little bit about the emotions that each party has in this situation.
You know, the emotions are very, very similar. The hearing impaired person feels guilt and anger and frustration, and they lose their confidence. They make a mistake one or two times, and they no longer feel confident in some of their choices. Interesting, the caregiver feels very much the same way. They feel frustration, anger, guilt, because they don't know how to help the hearing impaired person. They don't know how to encourage them. They get frustrated because they keep repeating. The hearing impaired person is frustrated because they keep having to ask things to be repeated.
Have you seen a lot of relationships between companions or caregivers and the person who is hearing impaired just dramatically change once they get their hearing aids?
It's probably one of the most fulfilling parts of the job is to see the hearing impaired person come in and just in tears, or the caregiver, thank you so much. We're enjoying each other again. We can watch television together again. We went to this museum. We went to the theater. We have our lives back together. It's very enriching.
Dr. Powell, why are people so resistant to getting their hearing checked?
You know, they're confused and they're scared. There's so much information. There's so many ads. There's so many, my friend had this, my friend had this experience. They often don't know where to start. The process is easy, non-invasive, friendly. You're going to come in, we'll take you into a sound booth, explain the directions to you, have the hearing tested, explain the results to you, and then if you need treatment, whether it's going to see a physician for a medical problem or if the treatment's hearing aids, we lead you down that course too. You don't have to be the expert. That's why you're coming to us. We're the experts. A hearing screening is a great short test. Basically, the audiometer, the test equipment is placed on normal hearing, and you either hear it or you don't. It just tells you whether or not you have hearing loss or you have normal hearing. That's a great test. It lets you know if it's worth your time and energy and money to have a full evaluation. The evaluation will give you information and your doctor's information on the pitches where the hearing loss is, the degree of hearing loss, the configuration of the hearing loss, all the information you need for treatment.
I know some people are kind of scared. I mean, it sounds like there's so much that's involved. Is it a scary situation, or do people tell you when they get out of the sound booth, wow, that was a lot easier than I thought?
Exactly. They're often very apprehensive, and we take them in, we explain the test procedure to them, and we get the chance to treat them and put hearing aids on them. Is that when they come back and they say, I wish I had done this sooner. It was so easy. I hear so much better. You get a lot of satisfaction out of that.
Why do hearing aids vary so much in price?
Well, hearing aids are priced by technology. The more advanced the computer inside the hearing aid, the more expensive the hearing aid. The more advanced the background noise program, the loudness control program, the feedback control, the more advanced their technology, the more expensive. Now, hearing aids are still man-made. They still require a lot of human labor.
Or women-made.
Or women-made, absolutely, women-made. So it adds to the price of the hearing aids. In the past, hearing aids were priced by size a lot of times. The smaller the hearing aid, the more expensive. Not necessarily now. It really much more is on how advanced that computer is inside the hearing aid. Some insurances actually have a benefit, or they've contracted with a company that does have a benefit. We advise all of our patients to check with their specific insurance before they come to see if they have a benefit. And if they can bring us something actually in writing, that helps.
So if their insurance does cover it, which would be fantastic, can they then, will you file it, or do they have to file it? How does it work?
Well, Let me clarify one thing. Most insurance companies may have a benefit. They may pay a portion of the hearing aid. But we will file it. We will help file it for them, or if they want to file it, we can give them the paperwork to do.